Someone yells back. The chair now recognizes Mr. Carter from Georgia for 5 minutes.
Thank you, Mr. Chairman, and thank all of you for being here. As we all know, we've got a healthcare worker shortage here in America, and we certainly have it in the state of Georgia as well. As a consultant pharmacist in nursing homes for many years, nursing homes have been especially impacted by the healthcare shortage, and it's something that I'm very concerned about. Healthcare provider shortage is one of the biggest challenges facing our healthcare system and our nation right now. We all know that. In fact, there was a recent survey that said that the U.S. will face a shortage of up to 139,000 physicians and advanced practitioners by 2033, including shortfalls in both primary and specialty care. You know, I don't know that it's the total reason, but I would submit to you that more than any other agency, that the FTC has failed the American public by allowing consolidation in healthcare like they have. I would submit to you as a pharmacist that the primary reason for high drug costs is the consolidation, the vertical integration that exists in the drug pricing chain, where the insurance company owns the PBM, that owns the group purchasing organization, that owns the pharmacy, that owns the doctor. Do you, Dr. Furr, do you know who employs the most physicians in America right now?
I'm not for sure, but I would guess United Healthcare.
You are absolutely 100% correct. United Healthcare employs more physicians in America now than any other organization. And it's not just pharmacy. It's also in the healthcare system. It's the hospitals. Now, look, folks, I'm not opposed to anybody making money. I know we live in a capitalistic society. I get it and I understand all that. But we had a meeting, Mr. Chairman, here with the Energy and Commerce Committee. It wasn't a hearing, it was a meeting. We had the Congressional Budget Office, the CBO, we had the director, and we had 20 staff members. I asked them that question. I said, give me one example of where consolidation in healthcare has saved money. Crickets, nothing. One example where consolidation in healthcare has saved money. Whether you're a Democrat, a Republican, or an independent, you all want the same thing in healthcare. You want accessibility, affordability, and quality. And consolidation has done away with all of those, I would submit to you. Now, I'm not saying that we don't have quality healthcare. We do. We've got the best healthcare in America and in the world, right here in America. But the consolidation that has gone on, you know, I don't expect for you to tell me, but I'm going to tell you who I'm voting for president. And that's going to be Teddy Roosevelt, because we need somebody back here who will bust it up. And he can do a better job dead than most of these people can alive. I'm just telling you. Let me ask you, Dr. Furr, what kind of misaligned incentives do you think that we have right now in healthcare that's causing some of these shortages?
I think so many of the things, and the things that when you talk to our physicians, our biggest thing is administrative burden. And as you know, working as a pharmacist, you know, when administrative burden started out, that was to take care of high-cost items, so we weren't overusing PET scans and prior mobility devices. And now we're doing pre-authorization for generic drugs, so that just because they changed their formulary, a patient that I've had on their diabetic hypertensive medicine for years is well controlled. I get a letter from the program, from their plan, saying we're no longer going to cover that drug. And then they won't even tell me what drug they will cover. So then I've got to call the pharmacist to say, what drug do they cover? So we don't know, you've got to send it in, and then we'll let you know if it goes through. So you might have to do that 2 or 3 times. There's no transparency there. At least give me a half a shot by telling me what you're going to cover. And they might be doing it to save 2 or 3 cents on the dollar. And then for what little savings they get, that patient might wind up in the emergency room. That patient might have to make 2 or 3 visits while I'm changing their medicine to get them back under control.
And not only that, and I will tell you, when I still own my business, when I still own the pharmacies, I had an employee totally dedicated at nothing but prior approvals. That's all they did was prior approvals. And people, and it decreases compliance. Because, you know, I get a prescription from the patient, from the doctor, and I'm sorry, I can't fill it right now. I got to call and get a prior approval on this. And then it's 3 or 4 days, and they don't come back, and they don't get it. They go without it for 3 or 4 days, and a lot of times they just don't come back, period. I'm telling you, Teddy Roosevelt, that's who we need to vote for. Mr. Chairman, I yield back.
Gentleman yields back.